outside place was kind of stupid, because why hadn't he or she, you know, thought of this or some other esoteric type thing. And you know, I went, and there was this guy who had a GI bleed, and he was an alcoholic, and so they have these kind of varicose veins in their esophagus, and he was bleeding from those. And a lot of times you have to put a balloon in there to try to put pressure on it, and there's some drugs that you can give them to slow them down. Well, I didn't have access to all these drugs, so we got a helicopter, and I took him across the lake to the University of Vermont, where I met this intern, who was, you know, now 4 years my junior, and she's just pimping me with all these questions. Now, why did you do this? Why did you do this? And I said, oh my God, I'm the local medical doctor now. I'm the stupid one. And so that was a depressing ride back home. And I told my wife, I said, yeah, I can't, I'm just kind of getting stagnant here, so I'm gonna, you know, I had more time to give back, but I didn't give it back all the way there. I signed up for more time to pay back so that I could do my fellowship in the military. And so I did the Hematology Oncology Fellowship at Walter Reed in D.C. And then I owed more time, so I did that in San Antonio. And when all was said and done, I graduated from medical school in 1980, and I got to Greenville in 1990. And joined a group there who were 5 people. So that was 20 years ago, and you know, this area has grown, and you know, now we have 26 in this group. And the one thing that they don't teach in medical school or residency or fellowship is that, you know, when you're out there, and you know, you all may do something within a hospital, you may do something within a medical center, you may be teaching medical students, you may be doing basic bench research, clinical research. But if you're going to be out in the community, like a lot of us are, you're going to be part of a private practice, and you're going to employ nurses and all kinds of other personnel, and it's a business. And they don't really prepare you for that. And you know, I don't know how it's going to look. You guys are sophomores and juniors, and you're getting ready to apply for medical school. I mean, you're probably 10 years away from what the reality of what medicine is going to look like in America. So we got to look at 2020, and nobody's got that kind of a crystal ball to let you know whether or not anybody's going to be a private practice anymore. I mean, the day of the general practitioner, maybe that works in South Dakota, but it doesn't work, you know, in most places in the country now. So it is a business, and you've got to kind of take that into consideration as well. As far as one of the things Amanda said is, you know, what is my day like? You know, at this point, and you know, I'm getting older, and so I have to, you know, get up early, and I usually do some kind of exercise because, you know, my body just doesn't respond like it used to, you know, for athletic events or anything. Not that I do that any athletic event. And so I get up and exercise, and usually go to the hospital now. I'm just moved out to be full-time in Seneca, so I'm the only doctor out there. And so I'll go around to the Coney Medical Center, and then the clinic starts about 8:30, and I'll see 18, 22 patients. I have a nurse practitioner who works with me, and she's seeing about the same number, you know, and most of the time she's fairly self-sufficient, but there are times where we have to interact. She'll see a lot of new consults to take in their information, and then we'll kind of discuss them together. We do also have a radiation therapy doctor there as well. So, you know, within my group, we have medical oncologists and hematologists like myself. We have radiation oncologists, which is a separate subspecialty where they're actually, for tumors that are more localized, giving specialized radiation therapy to kill out the tumor without affecting the normal surrounding tissue. And we have GYN oncologists because that's a combination of both a surgical and a medical subspecialty. And so that's where the 26 comes from. From the standpoint of you know, how you try to balance your life as a physician, as well as your life outside of medicine. My wife has given talks to younger doctors' spouses and says, you know, they say medicine's a mistress, but she said, I've never put up with a mistress. Okay, I have to put up with this. And so she equates it more as an in-law that you have to kind of deal with. But it's hard. We have 4 kids. And there's no way that you get to all their stuff. Okay, you know, your parents may have gotten to your athletic events and, you know, every award ceremony and you know, dance recitals and piano recitals. And I didn't get to that stuff. And you know, we videoed it and that sort of thing. But there's a balance, and you don't, because you can't leave your practice. You don't take many vacations. And then there's the call. And you have to always say, when a letter comes in and says, and invites you to something, you have to look to see whether or not you're on call. If it's really important, you have to switch with somebody. So it does impact on your life, okay? But there are rewards. I mean, you have a special relationship with other people that are in need, families that are in need. Sometimes the story doesn't end well, but you know, you can get them through that process as well. And oncology, hematology oncology it's kind of you're drawn to it because you're still taking care of the whole body. You're not necessarily a specialist. You know, and we can go through if you have questions about a specific subspecialty and what I think of the ups and downs of those things. We can certainly talk about that. But hematology oncology is really the whole body. And you're taking care, if the cancer is not dealing with different organs, your therapy for the cancer is dealing with different organs. And so it really helps you keep on your toes. The other thing is it's very dynamic. I mean, what we were doing when I was first doing fellowship in the late 80s and what we're doing now is entirely different. And a good thing. You know, that's a good thing. But we are actually getting down to the basis that there's DNA that goes on and does some different things, and there's some other things from the standpoint of how it's translated into proteins and that sort of thing, that a normal cell and a cancer cell are different. And so you can differentiate your targets for these things. So you can actually affect the cancer cell because it's a different cell than the normal cell. So there's more in the way of personalized medicine. We can actually take a person's tumor, we can assess that tumor to see what it's doing. It's different than a normal cell. And we've got more and more ammunition against that that's not particularly toxic to the host. So I think we're making headway. We still give chemotherapy. There's still, if you have somebody who's in the movie, if you saw the Bucket List or something, I mean, if somebody's taking chemotherapy, they're losing their hair and they're vomiting. I mean, some of the things happen. I mean, we're still doing that. I mean, we're a whole lot better, not people not losing their hair, but people not vomiting. So I think it's a very dynamic field. It does, however, imply that you have to keep up. There's lots of articles and journals and stuff and newness that you have to stay involved with. Like I say, you have boards, and they don't last forever, so you have to re-up about every 10 years to take another test. And while you're very good right now at taking tests, as you get older and you don't take them all the time, it's a pain. They're a pain now, but it becomes more of a pain when you don't do it every day. So there is a dynamic as well that has made life a little bit better when you're on call, and that is the program called hospitalists. So when you're in your residency, you're the doctor that's in the hospital, and it's usually kind of self-enclosed. You're getting admissions from some of your attendings, but when you were in a community setting, you were kind of the doctor and the hospitalist all together. So if somebody of yours came in because they were sick from their therapy, or they had fever because they didn't have any white cells to fight off infection, if you got the call, you got to go in there. And now we can. There's somebody in the hospital 24/7. They're on shifts, so they're not overly tired. and they can get them in the hospital to allow you to, see your patients the next day without being too fatigued. So that's helped. As you've heard from all the political debate, medicine is under the microscope now. It's unsustainable at the growth rate that it's going. A lot of that is because we have new procedures, new technology, new drugs. All of these things are very expensive. And one of the things that I find is that in America, there are just expectations, and they're high. If you were to get on the evening news tonight, just watch the evening news, there'd always be some kind of medical breakthrough. And it gets people kind of tuned in, especially if the medical breakthrough is for a disease that you have. The problem is that while it sells commercials, it's not available to everybody. And if it becomes available, it's going to probably be very expensive. But there's certain expectations. At the end of the day, we all have a fairly finite amount of time here. There hasn't been immortality, as I say to my patients, on this side of the rainbow. Yeah. So I think, but there are people that have expectations that they're going to live forever. And so that is a lot of why we have very expensive care in this country. So there's a lot of problems with medicine. There's a lot of expectations. It's difficult to balance your life. You don't take many vacations, but it's an honorable profession. I don't know many farmers that take vacations either. And there's lots of people, and probably some of your parents and stuff, who work as hard for a lot less rewards. So at the end of the day, it's very difficult to get where you're wanting to go. It's hard once you get there. The rules keep changing. There's a lot of things they didn't tell you in medical school, like how to balance a book and how to bill for something and get it back in a reasonable period of time, and how to take care of employees and employees' issues. But at the end of the day, I have no regrets. And I would do this again. Would I say that every night? Maybe not every night, but usually by the time morning rolls around, yeah, probably. So that's this profession. I'm open to your questions, and we'll just kind of open it up to some dialogue here. That's okay.
How many of you guys are strongly considering oncology? Realizing you have at least a little bit of an interest here when you came tonight.
Now, I'm always suspicious because, when I have a medical student with me on the board, now they want a good grade, so they're going to tell me that they're going to go into oncology. And then they go to the nephrology service and they say they want to be a kidney doctor after that. So, what is it that draws you to oncology? Is it something personal? I mean, is it, if there are people in here who have, had close personal friends, relatives, brothers, sisters who have had a cancer problem.
David, I'm going to call you out because I know your name. Why'd you raise your hands?
Well, it's more so just a general interest, more so my main, I guess, desire to be a doctor of any sort is to have just to have an impact on someone's life in that way, and just to really just feel that that's my calling, just have that kind of a purposeful impact on someone's life. And I feel like oncology, you can do that. I mean, you have that every single day. And besides that, just cancer in general, how it works and everything, it's just a small little interest of mine as well. So I'm interested in seeing more about it. So
what year are you?
I'm a senior technically, but I'm not graduating until December, so I'm junior as in getting into medicine.
So you'll apply?
So I'll apply August, like August and September.
August, September, this coming year.
Yeah, for the